to talk about, you know, how to do it properly, and we're going to talk about if you need to do it in a different way, how would you do it, okay? So what I want you to do is lay down on your back, please, ma'am.
Supine position,
So we're going to start in a supine position. Why do you think that is?
because it's the easiest to get a lot of the measurements.
So what we're going to do is we're going to stabilize the
either.
trunk, we're going to stabilize the proximal segment so that we can get a really good measurement, okay? And I'm just looking to make sure I'm telling you what your book says. Oh, she's back. All right. When you're having somebody lay down, are you fine? Is your back fine?
Mhm.
Okay. Sometimes people have back trouble and may need to put something underneath their knees to take a little pressure off their low back. Or they could just flex their knees, that's fine. Okay? So what you want to do, is you want to, now obviously you're probably not going to have the table up so high if you've got a stool. You want to get eye level with what you're looking at so that you're reading this straight head on. Okay?
Kind of like when you have a measuring cup when you're measuring at home, you want
Yes.
to get eye level with your measuring cup.
Yes, exactly.
Whoa, that's cool.
Get you up right and get you high level. Fortunately, I'm short and that doesn't take much. All right, so what we're going to do is we're going to look at shoulder flexion. Okay, that's our movement. Okay, so what's our normal range?
180.
0 to 180. Okay, what do you think our axis for that movement is going to be?
It's going to be frontal because it's this, or sagittal movement.
Right.
Sagittal plane.
Right. Okay, so that axis point is where you're putting your axis point of your goniometer. Okay, your book calls it the fulcrum. But you know what that is, right? So obviously we've got 0 here. Typically for flexion and abduction, 0 is not, like you always get 0 because gravity makes that happen. I've never really known somebody stuck out here, okay? So what do you want to do? Do you want to look at active range of motion or passive range of motion or both?
Only active if passive is not, if
Only.
you don't need to do passive if they have full active. Okay.
So what I may do is, Julie, how far can you move?
All
Okay.
the way.
So she's good, so we know, yeah. But, you know, all the way for her might not be a full 180, so let's just come up here. So what we're gonna do is we're gonna visualize, here's our axis. It kind of dives in when she gets all the way up, though, doesn't it? Can you see that? Okay, so what you have to do is once you get up here, you're just gonna visualize that it's gonna be right in there. Okay? Put those x-ray glasses on. Okay. Where's our stable arm?
It's on the trunk,
Okay. And where's the movable arm?
on the movable part.
On the movable part. Now look at this. You see how my axis is high? So I may want to have you move over a little bit so that we've got the edge of the table. Okay. Now you see how I can get into that axis pretty well. Now I'm following her body, but look, there's the look at the line of her seam. Is that straight at all?
No.
No. What if the line of her seam, you know, it's like, don't follow the seam of her shirt. Really pay attention to what her body's doing, okay? So here's our axis, so our stable arm is here. So our movable arm then is gonna follow the humerus. So you visualize where that humerus is. What does your book say about, does it give you an endpoint? So you're looking at the lateral midline of the humerus. Okay, you can aim, you know, if you're looking at your humerus, you know that that olecranon is like really in the middle there, right? So you just look at that, and then you read it, okay? Now, what I'm gonna tell you is a couple things with goniometers. One is some of them have like really floppy arms. Do yourself a favor and try to get one that's got a little stiffness to it so that you can handle it, because what's going to happen is you're going to have somebody with a dark colored shirt on, including sleeves. I can't read this against that purple shirt, you know what I'm saying? So if it sticks, then you can pull it away where you can see a contrast and see what your numbers are, okay? So here's my 0 point, I'm coming up here. Okay. And we we actually have 170.
Can she even go any further with that?
If she wasn't.
Maybe. Is that really a big deal?
No.
No, it's not. It's not. I don't, you know, if we're in the 170 to 180 range, I'm not worried about it. Okay? Now, while we've got you in this position, scoot over a little bit. We're going to talk about abduction. Now, your book shows abduction being measured sitting up. You can do it either way. I kind of like abduction laying down because, again, you can let the bed support your body better. And if you've got weakness in your arm so you can't really do this, then the bed can support that because we're taking it out of gravity. Okay? So abduction. So a key piece to abduction is that you always want to externally rotate. So you always have them turn their palm up before they abduct. You have to do that because you've got to rotate the head of that humerus so the acromion gets out of the way. All right? So I'm going to turn her hand palm up. I'm going to say, Julie, I want you to slide that arm out to the side as high as you can go. What did she do there? Did she really abduct? She cheated on me, didn't she? Good girl.
Because you saw it.
Yeah, you saw it flop come up this way, didn't you?
Oh,
That's okay. It helped me make a point, thank you. So if you've got your patient doing that, it's like, nope, I want you to keep it right on the bed, so let's just go together. I'm not really actively assisting, I'm just giving her guidance. Okay, what's our axis gonna be?
sagittal.
Yep, our axis is gonna be sagittal, so you're gonna look at this point, here we go. It kinda dives down too, doesn't it?
So you go like the armpit?
So you go like the armpit. Okay? It's just visualizing where the center of that movement is. Okay? So we know where our axis is gonna be. Where's our stable arm gonna be?
It's gonna be on the trunk.
Down her body, and then the movable arm
Moving arm.
is on the movable arm. You'd be surprised how many people have a really hard time with that. Okay. Girls are fun because they have boobs. Okay. Again, you just want to go straight with the body. Okay. So bring your, just give me something to measure this time. Okay. So you see how I'm visualizing that humerus in there. That is actually going to give me 91. That's fine. I just didn't have her go all the way up. I told her to
go all the way?
You could have, yeah, you do want to have them go all the way. I was just having her stop to give me something to actually measure.
Okay. So how
So if it was all the way.
So if she goes all the way,
Would you complete the line?
you know, like you got 175 there. Okay. Now, I'm going to tell you in reality, if I do a screening and they can do this and they can do this, I'm not going to bother measuring. It's only when they can't quite get there that I measure it.
So you would just say full range of motion?
Yeah, full active range of motion, boom, done. You want to make a note of it in your note because it says I did look at it. Okay. And I have a friend who's a hand therapist, and she really hates, you know, WNL, within normal limits. WFL is the one she hates, within functional limits. She says that really stands for we forgot to look. So it looks like it's probably functional, but you know in your heart it's not full range of motion. You need to measure it. Okay? All right. So that's flexion, that's abduction. I'm trying to think of things before I have to flip her and flop her. So let's talk about internal and external rotation.
Are we just focusing on upper extremities today?
Yes.
Okay.
Yeah, we're not gonna do this for lower extremities at all until we get to that part.
Yeah.
Like we're gonna start studying all the muscles and everything for upper extremities. And I just don't wanna confuse it
Yeah.
yet. We've got plenty of time for all of that. Okay, so external rotation, how are we gonna measure that? What I'm gonna do is I'm gonna have you slide over just a little bit that way, okay? That way we've got the table to support your arm, okay? Typically, we like, let me go grab a towel.
You look like the Tin Man from Wizard of Oz.
No. This is exciting. Are you guys running out of memory?
Oh, yeah.
So awkward, everyone videotaping you.
YouTube.
Yeah.